Hello everyone, and welcome to today's webinar, Texting Patients 201, Reducing TCPA Compliance. My name is Rachel Arnold. I'm the Notifications Marketing Manager for West, and I'd like to thank you for taking time out of your day to be with us. Before we get started, I'd like to make a few administrative notes. Due to the high attendance and short time frame today, we may not have time for open Q&A session at the end of the event. So please use the questions pane on your screen to submit any questions that may arise throughout the presentation. If we do not have time at the end of the webinar to answer those, we'll be sure to follow up with you directly as soon as possible. You can also email questions during and after to healthcareideas@west.com. Secondly, for those of you who may have to leave early today, we'll be sending a recording of this session along with the presentation slides in an email that should arrive to you within 24 hours. And lastly, today we're discussing the Federal Communications Commission's rules and regulations for the Telephone Consumer Protection Act. However, we want to remind you that this presentation is informational only and we're not providing any legal advice. Please consult your legal counsel for advice related specifically to your organization. Next, I'd like to take a minute to introduce today's presenters and tell you a little bit about their experience with compliance and regulations. During this event, you'll hear from West VP and General Counsel Jeanette Nelson, as well as West Compliance Specialist Rebecca Johnson. Jeanette has been with West Corporation for over 13 years and is responsible for regulatory compliance as well as privacy within our organization. She holds a law degree from Creighton University as well as an MBA and is a Certified Information Privacy Manager for the U.S., Europe, and Canada with the International Association of Privacy Professionals. Rebecca is also a Certified Information Privacy Professional with U.S. and international compliance knowledge covering communication channels, telemarketing, SMS, push notifications, privacy, security, and other federal and state laws. She's been with West Corporation for over 8 years, serving as a liaison between our legal team, executives, and internal departments to ensure regulatory compliance for our organization and our clients. Our goal today is to provide you with enough information over the next 30 minutes so that you can leave today's session with a clear understanding of the Telephone Consumer Protection Act and what you can do within your organization specifically to ensure your communication strategy is compliant and successful. We'll start off discussing a few text messaging trends and the potential value this communication can bring to your organization. Then Jeanette will lead you through an explanation of the TCPA, how it applies to text messaging, and how it applies specifically in the healthcare setting. And finally, Rebecca will conclude our presentation with some best practice guidelines to help you maintain TCPA compliance and maximize success with your patient communication strategy. So let's get started. On our first slide, you can see some stats from the Pew Research Center that give us a little insight into the growth of text messaging as a preferred communication channel, as well as the value it could bring to healthcare organizations. So let's take, for example, traditional mail. Because the cost savings and successful delivery rates with electronic mail continue to exceed that of traditional mailing, most businesses and organizations are moving to digital outreach plans. So this means your patient's inbox is busier than ever with emails from all of the businesses and organizations that they encounter every day. So if you're trying to reach your patients via email, you could wait on average 2 days to receive a response from them. However, as you can see here, if you were to send a text message, you could achieve a patient response within 90 seconds on average. So just consider the impact that could have on your daily schedule, office efficiency, and your communication costs if you could receive an appointment confirmation or cancellation within 2 minutes of sending a reminder, instead of the potential 2 weeks it could take for a patient to receive a printed or mailed postcard and then act on it. The value of text messaging doesn't stop at your organization. 70% of patients indicated receiving text messages from their healthcare providers would be a value-added service. The Pew Research Center also found that consumers are sending, on average, 42 texts per day. So if we assume your patients are even close to that average, how convenient and easy would it be for them to communicate with your organization using the same outlet that they're already using that frequently each day? But it doesn't take a bunch of stats and figures to see that text messaging is growing. You can just look around you and think about your own text usage habits. The power of text is getting hard to deny. However, as with any new technology you introduce in your organization, it's always good to be knowledgeable of the associated risks and plan to avoid them, which is why we are all here today. The good news is the risks we are discussing are easily managed. So with that, I'd like to turn it over to Jeanette, who's going to shed some light on the federal rules and regulations that apply to text messaging and the healthcare industry specifically. Jeanette, take it away.
Thank you, Rachel. So the Telephone Consumer Protection Act was passed back in 1991, and it essentially was in response to some telemarketing issues that were arising. But it also included some restrictions on calls to cell phones. And back in 1991, cell phones weren't nearly as prevalent as they are today. So the rule was not, didn't seem quite as onerous, but today it is. So the TCPA prohibits calls to cell phones using an automatic dialer, a pre-recorded voice, or a text message. The FCC does consider text message to be a call under the rule, so they are treated the same way. If you want to send those kind of messages, you need prior express consent of the called party unless the call is for an emergency purpose. And emergency purposes is defined on your slide. It's a call made necessary in any situation affecting the health and safety of consumers. The TCPA also prohibits pre-recorded marketing calls and texts without prior express written consent. The rule does set forth some requirements for what that consent needs to look like and some things that need to be included. And one of the requirements is that it be signed. Electronic signature is acceptable. Pre-recorded marketing calls to landlines also require prior express written consent. There is a health care exemption to this written consent requirement, but you have to be careful about state laws related to telemarketing. So if you're maybe making an appointment reminder, but you're adding on the back end of it a message about teeth whitening or an offer for some other service, that will be considered a solicitation call, and you need to be aware of what the rules are, both at the federal and the state level, surrounding those types of calls. Why does it matter that why are we talking about the TCPA so much? The TCPA does provide for a private right of action. Consumers can sue for up to $500 a violation. This amount can be tripled if it's shown to be willful and intentional, and a violation can be per call or per text. So they can, the numbers can escalate very quickly. There has been a significant increase in litigation in this space over the last 3 or 4 years. These cases often turn into class actions, and we've seen many, many settlements in the tens of millions of dollars for violations of the TCPA. The FCC also has the authority to take enforcement actions for violations of the TCPA, and their enforcement authority allows them to assess up to $16,000 per violation in civil monetary penalties. So the numbers can get high very quickly, so it's good to focus on what we can do to make sure we're in compliance. In 2015, the FCC issued a declaratory ruling to address 21 petitions that were filed by various companies seeking clarification on the TCPA. They released that ruling in July of 2015. It became effective on July 10th. There were a number of things that were clarified in the ruling. The first is what an autodialer is. While the TCPA rules do define automatic dialing equipment, the FCC has expanded that definition over the years through rulings and guidance. Essentially, it's equipment with the capacity to store or produce numbers and then dial them using a number generator. This includes just making calls from a list of numbers. With respect to capacity, the FCC in this latest ruling made it clear that it does not have to have the current capacity to be a dialer. Future capacity is are also covered and could qualify the equipment as automatic dialing equipment. They said it has to have more than a theoretical capability of being modified into a dialer. What that really means, we may have to wait for some litigation to clarify what that is, but just know that if you're using equipment that may not have the capacity to dial today, if it's fairly easy to modify it to have future capacity, it will be considered a dialer under the rule. The FCC also clarified that the call initiator is the person or the entity who takes the steps necessary to place the call. They also talked about the called party. Many petitioners asked that the FCC clarify that the called party is the intended recipient of the call, but the FCC declined to do that. They clarified that it actually is the current subscriber to the cell phone and or the customary user of a phone number that's included in a family or business calling plan. This goes to the issue of reassigned numbers. If you have a patient that gave you their number, you're using it to make appointment reminder calls, you would have, from the provision of the number, and we'll talk about the healthcare clarification in a second, their consent to call that number. If they give up that phone number and get a different cell phone number and don't tell you, you don't know, obviously, if you don't have the consent anymore until you maybe make that call, or unless they would inform you. So the FCC issued a one-call safe harbor, I guess, for lack of a better term, for calling a reassigned number. It's very limited in use, and there are some parameters around how you determine whether a call is reassigned or not. So you have to be careful about really knowing your patient and keeping their information current. The FCC again clarified that SMS text messages are considered calls within the parameters of the rule. We talked about that just a few minutes ago. And then equipment that's used to originate internet to phone text messages to wireless numbers via email or a wireless carrier's web portal is considered automatic dialing equipment under the TCPA. So those calls would be covered by the rule and require the same consent. The FCC issued a healthcare clarification. They essentially said the provision of a phone number by a patient to a provider constitutes prior express consent for healthcare calls subject to HIPAA by a HIPAA-covered entity or a business associate acting on its behalf. The calls must be closely related to the purpose for which the patient provided the number, so appointment reminder, lab results, something like that. If you are going to rely on that provision of the number as consent, but you want to send a message outside of something that's closely related, you will actually need to get prior express consent and not rely just on provision of the number. The FCC also clarified that a third party can provide consent on behalf of an incapacitated person, but that consent becomes invalid once that period of incapacity ends. They also issued a healthcare exemption for calls where there's an urgent need and a healthcare treatment purpose that's made by or on behalf of a healthcare provider. There are a list of types of those calls, appointment reminder and exam confirmation reminders, pre-op, post-op, different types of calls like that. Unfortunately, with the exemption, they also listed a whole host of restrictions that apply to those calls. They can only be provided or sent to the number provided by the patient, which is essentially the healthcare clarification. You have some disclosure requirements. You cannot include any marketing, advertising, debt collection, billing information, or any other financial content. The messages must comply with HIPAA. Voice calls must be a minute or less, text 160 characters or less, and then they limit it to one message per day up to a maximum of 3 per week. Voice calls must have an interactive opt-out option, and text messages must have a stop to reply stop. Honor opt-out requests immediately, and the calls and text must be free to end user. That's probably the biggest restriction on this exemption because it's very difficult to know what kind of a plan your patients are on. That free to end user includes not being counted against plan limits, so not voice minutes, text limits. So on voice, because you don't know what kind of plan they have, it's essentially impossible to know whether it's free to them. And on text, you would have to use a free to end user short code to make those types of text. So the healthcare exemption, while it exists, is somewhat of limited use. So that's kind of a quick run through of some of the requirements of the TCPA. I'm going to turn it over to Rebecca to talk about some implications and some ways to provide for texting and still remain compliant.
Thank you, Jeanette, for providing that legal framework around the use of autodialers when texting patients. So now that we know what we should or shouldn't do, the next question you may be asking yourself is, what does this mean for my practice? How do I make use of these rules? What decisions should I be making now? And what are the processes I need to manage these requirements? So in true legal fashion, the first step is going to be creating a policy. Over the past year, I've seen an increase in formalized policies outlining their course of action to the TCPA. Naturally, these policies also include elements of privacy and security, but for this course, we're just going to focus on TCPA. This policy would be written by your counsel, who may already be aware of these types of policies. I've seen them called patient engagement or patient communication policies. These would not only cover texting requirements, but really any communication channel used to engage with your patient. Some of the components from the TCPA that will be in your policy include how you will establish prior express consent. So call out the clarification from the ruling we just covered if this is the definition of prior express consent for your practice. If you intend to deliver messages that are not closely related to the purpose for which the number was provided, then identify how you will collect, store, and manage the consent. Again, this section is going to be driven by your legal. They should be asking you what types of messages you intend to deliver to ensure that you've got the proper consent. Secondly, you're going to identify required disclosures. For example, in the texting channel, those disclosures would include consent language for texting, confirmation of opt-in, consent confirmation messages themselves, and any reconfirmation of consent messages. So again, your counsel, they should be familiar with these terms and what should be included in the policy. Approved message content is critical for a practice to define, and one of the areas where good intentions can bring you TCPA risk. Message content is derived from considering the purpose, your intended audience, and the communication channel. So in this section of your policy, you're going to identify the data elements such as PHI or PII that will be allowed or restricted, when to use right party verification and disclosures within messages, greetings, and the length limitations for voice, and also that 160-character limitation for text. So in developing a TCPA compliant engagement strategy, you'll also need to consider how and where you capture patient preferences in managing those opt-outs. So let's dive a little deeper into those two topics. Consent is at the core of patient preferences. Capturing and adhering to these preferences is how you're going to honor their consent. Technology can greatly assist in this space, and at a minimum should allow your patients to provide consent and revoke consent. Specific to the text channel, this can occur through texting start to join a short code or stop to revoke their consent. On the screen, you will see an example of a solicitation message. I'm calling this out here because I want to remind you of the risks associated with solicitation text messages and what they may look like. If you are collecting consent through the healthcare clarification for consent, which remember that's the provision of the phone number by the patient, you cannot send solicitation text messages like this one. Going back to your policy best practices, if you do not want to capture consent specific for solicitations, then you should restrict your practice from using the text or voice channel for that matter. To be clear, solicitations are allowed, but there are additional federal and state regulations that must be evaluated, including written consent, as Jeanette just covered earlier. Continuing the conversation of patient preferences, patients should be able to revoke or opt out of receiving text messages. The TCPA is clear on discontinuing text messages when consent has been revoked. Again, technology can greatly assist in this area by managing and storing the opt-out request. Opt-out requests can come through various means, such as verbally at the front desk, via your website, or from their mobile device. Create a central location for the opt-out to be stored. This can be stored and managed by you, or you can leverage the solutions on the market. The key here is to ensure no further communications are delivered to a mobile number once the consent has been revoked. This will typically be stored in your PMS or your communication vendor. Integrating compliance requirements into your patient messaging strategy is essential to reduce risk around TCPA violations. But those aren't the only areas to consider when striving for an effective messaging strategy. Texting is a great channel for communication, but it isn't the only channel patients want to hear from you on. Integrate voice and email channels into your overall strategy. Allowing multiple channels gives patients the ability to choose their preferred channel. Your patient demographic may cover multiple generations, and they each come with their own preferences. While language options may not be essential for every practice to provide, just know that there's technologies that allow you to add this layer. The last two best practices are often overlooked and not managed. Without oversight, you could lose sight of how many times a day you're communicating with a single patient. Before understanding the right cadence, let's take a closer look at an email, voice, and text channel. Email, voice, and texting may reach the same patient, but the information shared and the invasiveness of the channel are going to vary. When dealing with patient information, some channels just may not be appropriate for the message you want to relay, or it doesn't even support the type of response that you need from the patient. Avoid over-messaging and take communication channel into consideration when planning your message timing and content. When it comes to TCPA lawsuits, some of these start because an individual felt harassed, such as the doctor delivering an appointment reminder every day starting 5 days before the appointment. To reduce risks in this area, set processes and boundaries for how and when you communicate by considering the message to deliver, the appropriate channel, and the frequency of the messages through that channel. The best strategies will incorporate all three. Let's look at an appointment reminder strategy, which most all of you can relate. The goal is to reduce missed appointments. Common reasons for patients to miss appointments are, I forgot I had an appointment, or I knew I had an appointment and couldn't make it, but forgot to let you know and reschedule. Utilizing what we know about email, voice, and text channels, we can establish a compliance strategy and frequency. 1 week prior to appointment, the patient will receive an email which could include a confirmation button, address to the office, link to reschedule an appointment, and additional information related to that visit. The voice call would reconfirm and remind the patient of their appointment and which doctor they will be seeing a couple days prior to the appointment date. For the day of, a text message is great to include the time and an address link to be opened in their MAP program for their convenience. There isn't a one-size-fits-all. Please consider your objective, whether it's reduced missed appointment, improved patient satisfaction scores, or revenue cycle management, whatever it may be. Combine your objective with the type of message to be delivered, and then create a strategy for each. This is a best practice, not because it's easy, but because it is strategic, thoughtful, and compliant. This will result in higher ROI from your patient engagement strategy, and you will reduce the risks of non-compliance to your practice. Thank you again for your time today during this presentation. There are a few key takeaways that we hope you will consider when developing your engagement strategy. The first is TCPA does, in fact, apply to text messaging as it does to voice calls. Secondly, the FCC's ruling provided the clarification for prior express consent, specifically to healthcare. Review this with your counsel to make a determination for your practice and the messages you're delivering. The first step in compliance, best practices, starts with defining policies and procedures around not only the text channel, but also consider the voice channel. Consent and revoking consent should be documented, stored, and managed. Make use of available technologies to perform validation checks before sending a voice call or text. And being compliant is one step toward reducing risk. Integrate compliance into your multi-channel strategy while considering your patient's preferred channels. Bottom line, TCPA compliance is achievable in a way that will not hinder patient engagement.
Okay, thank you, Rebecca, for going through some of the implications specific to the healthcare industry and practices and organizations joining us today. We hope that everybody was able to take away a good understanding of the rules surrounding patient communication, as well as some actionable best practices that can make adding text messaging or automated communication within your organization a little less scary. I'd like to thank Jeanette and Rebecca for their time today and encourage you to send any questions you thought of during our presentation or any that may come up once you've had a chance to digest the information to healthcareideas@west.com, and we'll be sure to follow up with you as soon as possible. Again, within the next 24 hours, you should receive an email from us containing a link to the recording of this webinar, along with a copy of our presentation, so that you can reference it again in the future or share with colleagues who may have missed today's event. I'd also like to call your attention to our newest free resource. If you're a current client, you may have seen this in our monthly newsletter. For everyone else, the white paper discusses topics around TCPA compliance and patient communication best practices like we've discussed today. If you'd like a free copy of this resource, you can go to televox.com/compliance guidelines and request one. Lastly, once you end your session today, you should see a short survey pop up. We'd ask that you please take a minute to complete the survey and provide us with some feedback so that we can continue to improve our webinar offerings and better meet your needs. That concludes today's event. Thank you for coming and have a great day.